All right, welcome back, everybody. It's time for some free therapy. October is ADHD Awareness Month.
And joining us now is Dr. Laura Saunders. She's a child psychologist with the Institute of Living. I've got a lot of moms who've been asking questions, especially in the Channel 3 Mom Squad, so join there. But last week we talked about typical symptoms. Today we're going to focus on the intervention. So thank you, doctor, for being back with us. Your hair looks great.
Thank you. Hello, friends, and happy Wednesday. Wouldn't my hair look great with one of those berets Scott brought back from France?
I know. They were 3 for $10. I should have gotten a whole bunch more.
So, yes, let's talk about some interventions. I think that, while medication certainly is an intervention, there are other things that can be done first to try to give your young person or your teenager some skills to manage impulse control and frustration tolerance, because those are two of some of the most debilitating symptoms. What we know is that medications really do address the attention and thinking. And while it seems antithetical that you would use a stimulant to address thinking and attention because it stimulates you, it actually works extremely well for ADHD and is one of the most long-studied medications for children and adolescents.
So I want to just talk about that because people are looking online, and there's so many people who are afraid to give their child a medication trial. Like, oh my gosh, it's going to ruin them, or it's really this is basically meth. Can you speak to that?
Yeah, so I'm not a psychiatrist. I'm a psychologist. I don't prescribe medication. But however, the issue with some of the stimulant medications for ADHD is that they're in and out of your system in a day. So it's not like they're building up in your system for a protracted period of time. So you can tell pretty quickly whether or not a medication like this will work for your child within a day or two, because it's very active. I'm not going to talk about the half-life, but it's in and out of your system in a day. So if it's going to work, it's going to work or not.
I know a lot of parents have been reticent, and then they'll do a medication trial, which is that's how you can dip your toe into it. And that's a nice thing, right, is that you can tell right away, and sometimes it's life-changing for the kids.
Yeah.
Yeah, to be able to pay attention and focus and not be so distracted, because when you're that child or that adolescent that's so distracted, you're getting a lot of negative feedback. Teachers are telling you to sit down, to be quiet, to stop tapping your pencil, right? You get a lot of negative feedback. And over time, that really wears away on kids.
And you're saying that social skills don't come necessarily easy to kids with ADHD, which could also represent a problem.
Right, because they might have difficulty with the reciprocity and turn taking. They're more impulsive. They act out. So they often need help with social skill development. And I think a huge part of ADHD is actually parent skill training, understanding how your child is different and really addressing the needs from a systemic point of view, not just pointing your finger at the child with ADHD and saying, we need to fix you.
A stupid question, Doc, but would a child eventually grow out of ADHD, and would they be able to eventually come off the medication, or is this a lifelong thing?
It's not necessarily lifelong. I think what happens with individuals is their brain matures, and as your brain matures, and hopefully you learn skills to manage what your particular deficits are. So there are individuals that don't necessarily need medication, or they take what's called medication holidays. So it's not necessarily something that you have to take for life, but it is worth the trial if your child is really struggling.
Yeah, and teasing out and getting that diagnosis, I just want to encourage people to go back to the other Kara's Cures podcast. We talked about how to get a diagnosis, but there's also a lot of talk about organization, right, and helping your kids. What's something you could tell parents listening right now that are saying, oh my gosh, my kid, the biggest problem they have is that executive function, like disorganization and keeping up with things. How do they help that?
Right. So we see that the organizational deficits as kids get a little older, kind of middle school into high school, where organizational demands are greater. And that's when these kids start to fall apart a little bit more. You really need interventions in school. You need accommodations. So you need to go back to your school system and say, I believe my child's struggling. You might need help with actually getting a diagnosis, getting psychological testing, and then getting a 504 plan or interventions for your child.
And does a combination of therapy and medication work the best?
Absolutely. We don't just want to throw medications for any issue. we always want to use interventions, cognitive behavioral interventions, skill training. That's what's really going to be the best combination.
All right, so definitely, if you're thinking like, oh, this is just something that it's just how they're wired, we'll let it be. Doing the interventions clinically, you've seen huge differences in adult life if we get this treated when kids are young.
Yes. I mean, and Kara's course will go into more depth, but there's a lot of research that shows that the more you can deal with some of the more debilitating symptoms early on, which are impulse control and frustration tolerance, the more you can prevent problems in adolescence and adulthood.
All right.
All right.
Thank you, Dr. Saunders. We'll
Thanks,
talk
Doc.
more on the podcast on
Yeah.
Kara's Cures.